Now doctor, diastolic collapse of ventricle, classical of cardiac tamponade. Constrictive pericarditis, restrictive cardiomyopathy, cardiac tamponade. Today only you should review the catheterization findings, X descent, Y descent, etc. Similarly, equalization of all the 4 chamber pressures is another important hallmark among the catheterization findings. Idiopathic pulmonary hypertension, what is except about it, doc? Huh? All these are the predisposing, not the BMT. So HIV infection, hepatic cirrhosis, anorectic drugs, etc., etc., they are all the underlying causes. And BMT is a cause not for pulmonary arterial hypertension but for pulmonary veno-occlusive disease. It is a predisposing factor. That's the point in that. Okay doctor, open up your radiological eye. You are given a HRCT of this guy, elderly man having valvular crepitations. I think with that you will get the diagnosis. HRCT was done. What is this appearance called as? Beautiful. Honeycombing is commonly a feature of? Huh? Commonly? Ectasis or fibrosis?
Ectasis.
Ring shadows and all that is ectasis. Interstitial lung disease and fibrosis. Classically, it is a irreversible finding in case of ILD, the presence of the honeycombing. Okay doc. Co-worker hemiconiosis, basically the smoking will not increase the prevalence but it can worsen, it can have a detrimental function overall on the ventilatory function. Complicated parapneumonic effusion, when do you call, how do you treat?
D.
B.
Huh?
D.
C?
D.
That's right. There is no role for fluid cell count and protein. For all the clinical decisions, glucose and pH are important. If you plan to do any tube thoracostomy in a complicated parapneumonic effusion, fluid glucose less than 60, pH less than 7.2 is an indication. No more waiting and watching. You have to put a tube and drain. That's most important. What is wrong about pulmonary stenosis? Whoever answers this, we can give, we can say you are traveling towards cardiology. DM. Dear, good. Generally, what is the nature of all the right-sided auscultatory events, doctor?
Increase with inspiration.
They increase with inspiration. The only right auscultatory event that decreases with inspiration is ejection click of the PS. Why is the question? No? That's a big story. Nowadays nobody is that keenly listening whether it is increasing or decreasing like the days of Anton von Leeuwenhoek and diagnosing PS. We are all in the era of modern 2D echo, but still some story will be there. First of all, why click happens, if you know why it will decrease with inspiration in pulmonary ejection click. I leave that for you in the literature. Okay. Coarctation of aorta, what is your answer?
D. C.
Huh?
C. It is systolic pressure.
That's beautiful. That is, the systolic pressure is higher in the upper extremities. What is wrong about VSD? What is wrong about VSD? Huh?
C.
Typically VSD may, why there will be pulmonary hypertension? Left to right shunt is there in VSD. Increased right blood flow into the pulmonary vessels. Hence, over a period of time, there is a development of a pulmonary arterial hypertension. Because lung is flooded with blood due to VSD. अगर pulmonary stenosis है तो क्या करेगा वो? It prevents the flooding of the lungs. It protects the lungs from getting flooded. It acts like Nagarjuna Sagar dam, preventing the flooding of the lungs by this increased blood flow. Hence, Eisenmenger syndrome is protected. from happening if there is a coexistent PS along with VSD. That's where we build the dams, is what you need to basically remember.
Sir, what about A? In VST is membranous, yeah, most of them will close off, no sir. So in adults, it won't be.
Question is simple. Muscular or membranous, where is the defect?
Membranous will mostly close, no sir. So mostly,
That's a different story. Attaching two facts will make you go wrong in exam. Lakh's exchange principle you studied, no? Any touching of two facts will exchange the material and make your answer go wrong. That is called Lakh's exchange principle. So take the fact as fact per se. Sometimes you need to use logic, but not in open facts. Why sun rises in the east? Maybe because moon rises in the west. There is no reason for that. Sun rises in east, moon rises in west. That's the nature of the law. So now doctor, give an answer for this. Use your acumen. Which chamber of the heart is enlarged?
left atrium.
Left?
Atrium.
How did you know?
Double shadow.
Shadow within the shadow. Shadow within the two shadows you are saying, no? That is called shadow in shadow appearance. Where do you see this? Mitral stenosis, regurgitation, all these left valvular pathologies. 5-day-old female infant, blah blah blah, big story. Femoral pulses are decreased and delayed. What is your answer?
Coarctation.
Coarctation. Croup is due to parainfluenza virus. Epiglottitis is due to Haemophilus influenza. Which is more fatal if you don't treat, which require intubation? Epiglottitis of H. influenzae. Patient can end up in respiratory arrest. Cherry red spot. What's your answer?
A.
Cherry red spot.
A.
Metachromatic leukodystrophy. Cherry red spot.
Even in A, sir.
Not even in A. Uneven in A. It is metachromatic leukodystrophy, no doubt. Don't confuse for CRVO, CRAO, वो सब वो भी आंखें में होते हैं, मगर वो नहीं बताए ना. Now, triple screening
D.
doesn't include acetylcholinesterase. 3-day-old and GDCS, what is your answer, doctor? Febrile seizures, any part of the world, they don't need any long-term anti-epileptic therapy. Okay, doctor, use your radiological acumen, give an answer. What is this radiological sign? I am listening one boot shaped, that is in heart, this is stomach and gut. Double bubble, where is the second bubble? This is intestinal bubble, that is और कुछ कोशिश करो. Okay, I'll give one clue. I'll give one clue. Patient met a road traffic accident and came to you with a blunt injury to the abdomen.
Oligive syndrome.
Oligive syndrome, you want to say? Out try karo. Bring out all the abdominal contents of Bailey and Love. One after the other, which you have studied. We'll see where you will end up in dissection.
Pancreatitis.
Rush is saying coffee bean. Asha is saying congenital hypertrophic pylorus. This is called fitting the patient into our knowledge. So, try to fit your knowledge into patient's diagnosis. Yeah. Please give big clap, doctor. I got the answer. What's the name, doctor? Shilpa cracks the riddle of Sherlock Holmes by saying, loud clap, loud clap. That's good. Pneumoperitoneum. What is it? Abhi to batao. What is this sign called? Huh?
Crescent.
Hanif, what did he say? Regular? Something or, okay. That's good. That's good. Shilpa, if you by chance are in the waiting list of MD radiology, wait for the next round and take it. That's good. Wriggler's sign. 15-year-old doctor, clumsy, weakness is getting worse. What is your answer?
Guillain-Barré.
Guillain-Barré, post-infectious polyneuritis. Mycoplasma pneumoniae,
A.
basically hemolytic anemia. 2-year-old, not a common cause of otitis media, acute. What's up your answer?
D.
Huh?
D.
Which of the following is not a common pathogen for the acute otitis media in the background of the rampant immunization which we are carrying out?
Sir, D is not seen as
Sir, D is not,
pyogenes.
Which of the following is not a common
Not
pathogen?
a common, sir.
That's what?
Pyogenes.
D, sir, answer. D.
D.
Pyogenes.
Oh, you want to say pyogene should be there. Okay, maybe, must be then in that case. But otherwise we wanted to emphasize a point of H influenzae. Okay. 13-year-old girl, obese, pseudotumor cerebri. What is your answer?
D. D.
Normal
Sir,
appearance of brain and ventricles characterizes the pseudotumor.
Sir, if in case there is a thrombosis, transverse sinus thrombosis, then it will be visible now, sir, in MRI.
Absolutely, MR angiogram or I mean venography, MRV. So,
That answer will be wrong.
which answer? Achha, earlier question, you are still not out of crying about that mistake. There is nowhere written that radiologically nothing should be visible for you to call pseudotumor cerebri. Pseudo part of that is for normal appearance of the brain and ventricles. Not about the vessels, thrombus है या नहीं वो उसके बारे में नहीं बोल रहे. Normal appearance of brain का मतलब क्या है? If you take what is the other common condition where patient can have hydrocephalic changes? Elderly person, brain atrophies, then ventricles enlarge. So there you will look at the brain, how is it? So it is not normal. That is what the meaning of normal is. Good, no problem. Now 3-year-old, all story given to you with the diffuse lymphadenopathy, hepatosplenomegaly. ALL is the most common.
Sir, but bleeding gums was there in the question. Bleeding gums.
Yeah, classical bleeding. ALL means bleeding gums. There is no secondary thought. Don't think of choromas and AML in the gums. Oh, no. Locard's principle. Now, Avi, use your
Figure of
see,
8.
this is called as
TAPVC.
TAPVC.
mass mania in radiology. So that's excellent, doctor. Snowman appearance or figure of 8 where you find it in supracardiac TAPV, total anomalous pulmonary venous. What happens in total anomalous pulmonary venous circulation? Pulmonary veins, instead of draining into left atrium, they form a common vein and drain into the right atrium. So while forming that common vein and draining into the right atrium, they typically form the figure of 8. Once more, why is this divided into supracardiac and infracardiac? That common vein that they formed can drain into SVC or into IVC or directly into the heart. Accordingly, we have supracardiac, infracardiac and intracardiac. 3 forms of but it is not draining into left, it is draining into the right side of the heart. Normal turnover of epidermis,
4 weeks.
4 weeks, very good. Melanocytes are in
Corneum.
basal. Recalcitrant acne is treated with retinoid, that's good. Skin pigmentation due to
Busulfan.
busulfan. Then maximum nausea, vomiting, cisplatin. By now you're all entrance going Ghana parties, so you must be quite sure on the list of things. Most common site of atopic dermatitis,
Antecubital fossa.
C.
basically antecubital fossa. Then which one you will not give intrathecally?
Fentanyl.
Remifentanil.
Remifentanil is a selective opioid agonist, and it does not provide any post-operative analgesia, etc. ET intubation, what is true about it?
All.
It reduces the normal anatomical dead space.
All of the above, sir.
It increases the resistance to respiration, sir, not decreases. It increases the, anytime you have done ambio on a patient who is on ET tube, you will be knowing the resistance felt compared to directly putting ambo bag and doing the is easy. Sometimes doing it into ET tube is not that easy. Resistance basically it increases. About thiopentone, what is except about it?
C.
C.
What is the agent of choice in shock?
Ketamine.
Ketamine.
Ketamine, that's right. Shortest acting IV analgesic.
A. Remifentanil.
Remifentanil is shortest acting, 30 to 66 seconds is the onset and 3 to 5 minutes duration.
B.
Soft tissue injuries and suxamethonium and myoglobinuria you will not forget. Batao doctor, use your acumen on this barium meal, barium film. What is this sign called as? To help you we also put a pointer. Apple? Apple core is very very thin, not this much.
String
More thin than this.
String sign.
Crons.
Huh?
String sign of.
Who said?
Crons.
Thorn, somebody said thorn. Oh, very good, very good. I think, please give good clap to Ramakrishna. Abhi your responsibility for all pregnancies you created. Rose thorn, rose thorn appearance on a lighter vein. So, rose thorn appearance, jaldi bolo doctor, is typically seen where? In which condition? Don't leave your answer a unattended orphan.
Diverticulosis. Diverticulosis.
Oh, there you will have pouches, you don't have thorns. I heard Rupa telling clones, Asha giving the correct answer.
Pancreatitis.
Huh?
Pancreatitis.
Where is pancreatitis? Where is the correct answer you produced, doctor? Asha, please give a big clap to everybody. Huh? Crohn's. Who said? You also said Crohn. Anybody? No. Loud clap. Loud clap. That's right. Our Asha is saying Crohn's is correct. That's right. In fact, it can be. Thumb. You said what? Rose. This is. Oh, I'm sorry, doctor. Basically, this is thumb printing, which is seen in ischemic colitis. Where are we? But Crohn still stands as the right answer. Basically, any bowel edema will lead to thumb printing. There is one more. There are. See, for the same radiological sign, multiple names are also given. Okay.
Hallucination.
Hallucination. Very good. Hallucination. Illusion is misinterpretation. Thread as a snake. APPG as NEET PG. Is an illusion because notification came and you read it as NEET PG. Who will help it? Because you are still in the same illusion. Confabulation is
Memory.
what we do in Viva was.
Memory, sir.
We will tell examiner as such we read and forgot. Instead of saying we forgot to read. Now, methods of learning in psychiatry include all these things except
Catharsis.
So what is catharsis? Tomorrow when you are a psychiatrist, what will you have? A couch. Patient will come in a restless state, lies down in the couch, he keeps telling all his sexual fantasies, all his childhood abuses, everything. Ultimately your job is to bring the truth out. Catharsis. Just like you produce diarrhea in a internal medicine. All the bad things are ventilated, patient feels happy. Oh, thank you doctor for all the help you have done. By the way, where shall we date tonight? Then you will be in a real problem. So, most important thing is listening and ventilating the thoughts is all about the psychiatric catharsis. Course psychosis. What is your answer, doctor?
C.
It is the
C. Memory.
Organic amnestic disorder is what need to be remembered. Actually, except should be there. Then what is your answer? All these drugs are used except
Lithium.
lithium we don't use. Lithium is there in the option D.
Sorry, bro.
Now doctor, lobar pleural effusion.
Reverse lordotic.
B. Reverse lordotic view. Lordotic view can see apex. Reverse lordotic can see interlobar effusion. Right anterior oblique can see the right lung, left atrium, gallbladder, mitral valve, etc. Left anterior oblique can see tracheal bifurcation and right middle lobe. Supracellular calcification, where do you see, doc?
Craniopharyngeal.
Craniopharyngioma. All these are seen in meningioma except
Erosion.
C.
erosion. Erosion. Best imaging modality for peanut tumors? Radionucleotide is what you use. So what do you do in radiotherapy? Ionization. At least 120 marks you have to cross, no? So abhi aa gaya Ramakrishna ki diagnosis. What is this called as? In a barium study? Not I think Ramakrishna, not Ramakrishna, but
String sign of Cantor.
String
String sign of Cantor.
sign. String will be little longer string. Apple core. More than that, are you able to see any alphabet?
Reverse 3.
Reverse 3 sign.
Pancreatic cancer.
In case of chronic pancreatitis or even in case of pancreatic carcinoma also. Anything that lead to indentation becomes the chronic pancreatitis. 57-year-old underwent splenectomy. What is except about it?
A.
A. Octreotide will decrease the output of the fistula, but it does not hasten the healing, is what need to be remembered. Most common CHD?
VSD.
VSD, note second thought. 45-year-old, what is the most likely post-operative cause of obstruction?
Adhesion.
Adhesions, that's good. Now doctor, a 50-year-old hypertensive has a pheochromocytoma and CD and MRI do not reveal any abnormalities. What do you say?
D. Selective venous sampling. D.
Beautiful. Selective venal sampling. What will you do in that?
Measurement of this.
You will basically do the measurement of all the metabolites of the catecholamines is what need to be remembered. This is a beautiful point. I am waiting to see who will answer.
C.
C you want to propose?
Yeah.
Yes.
Vocal cord malignancy, doctor, in this country called India, where a lot of dietary factors, lifestyle factors, they are all the predisposing factors. So vocal cord that lead to fixation makes it T3. Massive involvement of the surrounding tissues make it T4. Presence of the homolateral lymph node more than 3 but less than 6 makes it N2A, is what need to be remembered. Now doc, one short quiz. Let me see who is good in probing into the interiors of the human beings. Colonoscope from anal verge, where will it reach, doctor? How many centimeters?
10 centimeters. 10 centimeters.
10.
25.
Ramakrishna, you are underusing a colonoscope.
25. 25 to 30.
25, 30 only. You are afraid to go more inside? 60. हाँ? और लगाओ. आपका bed कितना? How much is your bed? You have not assisted colonoscopy any day? Oh, come on, doctor. Colonoscopy में you must tell your professor, sir, you are doing excellent colonoscopy, sir. By the way, you look very tired. You like to sit, sir? Please sit. And then you need to hold the probe like a good student and pass 2 to 3 times you do. You are expert. Ultimately, you don't get seat MD. You can be a rural colonoscopist. Whoever comes, they will be paraded on a big queue. You go to city, they do colonoscopy for 5,000, You come to me, I'll do 500, discount sale 50 rupees only. And ultimately, there are few skills which will be your bread and butter. 60 centimeters, doctor. You can't do mistake. Proctoscope is what our Ramakrishna said, 10 centimeters, 12 centimeters. Even if you put the full proctoscope inside. Sigmoidoscopy is 18. Flexible goes up to 60. Colonoscope in fact will go up to 160. Quite long. Now, 68-year-old, Mohs excision at the tip of her nose, full thickness skin graft. Graft is pink. What does it mean?
B.
B.
Inosculation.
Inosculation is what need to be remembered. Regurgitating the fluids right at birth. What does it indicate?
D.
D.
It is esophageal atresia, dribbling of saliva. Term male baby, vomiting or abdominal distension, no passage of meconium.
Hirschsprung.
Hirschsprungs classically. Newborn baby, cystic fibrosis, abdominal distension with bilious vomiting. Classical story of meconium ileus. 6-year-old boy, abdominal pain, bilious vomiting and bleeding per rectum.
D. D.
Intersusception.
Michaels.
6-year-old boy,
6 years Michaels ఉండొచ్చు.
Meckels is more likely.
Sir, in intersusception also there is red currant jelly bleeding per rectum. All these will fit.
Meckels looks more reasonable. Age is any age for that matter, any of the two can occur. There is a characteristic age, but not that need to be the only age. Anyway, double bubble, didn't ask me. Premature 6-year-old, bilious vomiting, bloody diarrhea.
B. Necrotizing enterocolitis.
Beautiful. So intramural gas on abdominal X-ray. 10-year-old girl with fever, skin periosteal reaction, onion skin. Ewing's. Liver disease, Kejefing. Wilson. Today paper is very easy. Transilluminant fluctuant mass. Cystic hygroma. Abhi aa gaya quiz. Which part of the intestine is called characterless? Ileum. So you should be sure. Valvar conniventus, jejunum, hostile folds of large intestine, characterless is called as ileum. 45-year-old left-sided scrotal swelling with dragging discomfort in the right scrotum. What is your answer? You should think of whenever varicocele is there in an elderly person, think of renal cell carcinoma. Bag of worm feeling.
Bag of worms.
In the elderly, onipid is right-sided or left-sided? What drains directly into IVC?
Right side drains directly.
Right drains directly into IVC. Left side will take
into
renal vein.
So it should be more on. Okay, I think we'll change the frame. Yeah. Stored blood if you use, what are the labile factors? Basically 5 and 8.
Sir. Question.
Yeah.
Hepatectomy is needed, no sir?
What is needed?
Okay.
Abdominal trauma requires partial hepatectomy. He is rapidly transfused because of that. So you want to go for liver dependent factors. Once more, Locard's exchange principle. Now, 27-year-old was auscultated.
C sir.
I mean assaulted with left chest. So what is your answer?
C.
A.
C sir.
Equalization of the pressures across 4 chambers on gap.
A is also.
Expiratory.
When will the pulse collapse? During inspiration or expiration? 24-year-old receiving silver nitrate. What is your answer?
D.
Methemoglobinemia. 10-year-old girl 40 kgs weighing फ्लूइड रिसस्टेशन के लिए क्या इस्तेमाल करते?
D.
हाँ?
A. First volume replacement.
D, sir. D.
Which of the following is most important recommendation?
D, sir. D.
And on presentation, her heart rate is 160. Okay. Initial management is what was given?
Most appropriate.
Our BP is 60/35. And I mean most appropriate is different from what will you do immediately is important, but immediately if you have the blood also, blood transfusion is a preferable choice. Okay, doctor, you have given barium meal to the patient. I am not giving a mammographic finding, I am giving the barium meal finding. Stomach में barium गया. What does it indicate?
Pyloric stenosis.
Okay, ulcer. Good. I am happy to know. Which type of ulcer you want to prefer if you find this finding? You like to only two types of ulcers, benign or malignant, I mean to say.
Benign.
Which one do you want to consider?
Benign.
Benign. Anybody want to say malignant? What is this line called as? Hampton's line it is called as. Basically on the lesser curvature, whenever you are having a gastric ulcer showing Hampton's line, typically you consider it as a benign ulcer is what need to be remembered. There is one more sign which is called Carmen's meniscus sign, which is another important feature which you find in CS stomach. Doxorubicin में क्या होता? Cardiomyopathy. 63-year-old with a lump, Hurtl cell carcinoma. What do you want to do? Hurtl cell is a variant of?
Sir. C.
Papillary.
C, sir.
Papillary.
Papillary or follicular?
Follicular, sir. Follicular.
Follicular.
Treatment C. Total thyroidectomy.
Total thyroidectomy. Nothing less ambitious than that for this aggressive tumor. Otherwise, recurrence is very high. Now, prolonged ileus subsequent to a small bowel lysis of adhesions. What will stimulate the motility?
Acetylcholine.
Acetylcholine.
Any day it is acetylcholine. 63-year-old chylothorax 600 ml per day. What do you want to do?
Ligation.
Basically thoracotomy and ligation of the thoracic duct. Any chyle drainage more than 500 ml per day is an indication for intervention. 14 months after femoropopliteal bypass, 64-year-old urokinase was given. So what is the possible truth about it?
B. With
optimal treatment, 20% reocclusion is basically expected within about 1 year. 62-year-old jejunostomy is placed. When can feeding begin?
4 to 6 hours.
4 to 6 hours.
4 to 6 hours is what you can. Generally people wrongly think entire bowel will be in a state of paralytic ileus in the post-operative field, which is not truth. So colon is inactive for 3 to 4 days and small bowel functions normally within hours of surgery. 72-year-old, what is the physiological consequence of shivering?
B.
Obviously there is an increased production of the CO2 due to the metabolic activity. After a weekend to Shimla, 42-year-old comes with numbness and discoloration of forefoot. Discoloration है तो उसको क्या बोलते हैं? Trench foot or frostbite?
Frostbite.
That's right. So immersion in a water of 40 to 44 degrees. Don't put it in the furnace, the legs. So that is what you need to do. And don't do that. Rubbing is bad. That can further worsen. Elderly male pedestrian suffers a unilateral fracture of the pelvis. How will you manage, doctor?
B.
Basically, short-term bed rest and ambulation should be allowed.
Sir, pelvic fractures are most commonly associated with massive massive bleed.
Right?
So you should check if artery is injured or not, no sir.
And then make it massive. And then treat.
No.
They are not always massive. I mean, in the sense, generally pelvic fracture is there means it's a serious form of road traffic accident. But bicycle riding milk delivery man is not like hitting a car.
What if he is hit by car?
Just because,
What if he is hit by car?
what is it if it is hit by car? It's a good point. What he had is basically a single break in pelvic ring. वो तो डिस्क्राइब किया हुआ ना, unilateral fracture of pelvis. That is relatively milder form of pelvic injury. So that makes it rest as the treatment. Hyperkalemic calculus. What is your answer, doctor?
A.
A.
Congenital hypertrophic pyloric ये बोलो, what is this appearance? As too many barium studies.
Appearance.
This is little longer.
String sign of Cantor, Kranz.
String.
Your rose thorn. Where is rose? That's right. The rose thorn is true, which is typical of Crohn's. Ring sequestrum, where do you see, doctor?
Amputation stump.
In case of stump amputation, ring sequestrum, tubular sequestrum. Where do you see rice grain sequestrum TB? After exam you need not remember. Anterior dislocation में क्या होगा shoulder का?
Axillary.
Axillary nerve injury, let's run fast. Fracture shaft of humerus.
C.
Basically brachial artery occlusion requires immediate surgery. Supracondylar fracture of the humerus, is there any conservative role?
No.
Admission to hospital is essential following reduction. And also you need to check whether reduction is successful or not. A child is pinned, pulled elbow. Generally a pranky child who don't want to listen the big brother's word. Big brother thinks I am the senior here, you are the junior, why are you not hearing, and rises. Pulled elbow. And nothing to worry. Pulled elbows you can reduce, in home only you can reduce actually. So that's very easy. It's also called nursemaid's elbow. Now, Colles fracture, what is except? Is it dorsal or ventral?
Ventral, dorsal.
Dorsal, sir.
Dorsal tilt. Sudex hypertrophy, what is except?
D.
D.
It is
Self-limiting.
Sympathetic.
No.
Sudex
Bad
hypertrophy basically is not
It is bad prognosis.
it is not D is wrong. Burning pain, stiffness, erythematous, cyanotic. Prognosis is not good if Sudex hypertrophy develops.
D.
Internal fixation is needed
D. D. sir.
except for the scaphoid, which is managed conservatively. Commonly injured
A.
carpal bone after scaphoid. Trapezoid. You thought lunate? Anybody?
Yes.
I know. Scaphoid, triquetral trapezium 4.3%, then lunate, then hamate, then pisiform, then trapezoid. Least. Gamekeeper's thumb. What does it mean?
A.
Yes, sir.
Ulnar collateral ligament injury of the MCP joint is what need to be thought. Okay, doctor, use your radiological acumen. You are given an abdominal radiograph. We also pointed an arrow.
Sentinel loop sign.
Good.
Pancreatitis.
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 So, in this case, which part of the GIT it is? Colon.
Colon.
What happened to the gas? Abruptly cut off. Colon cut off sign is what you typically are seeing in the case of the in this given case.
A.
Now,
A.
A.
we have hypermetropy. We are all born hypermetropic. Mydriatic in 3-year-old should be
B.
B.
Ointment.
ointment of 1% atropine, which should be strong. Then anisogenia means
D.
difference in the size of images between the two eyes. Treatment modality in myopia is keratomyelitis. Once more, lot of questions come on how much refractory error is corrected. Myopia surgery, doctor, in ophthalmology, favorite question.
Radial keratotomy.
Huh? It is also there in the options. Oh my God, I think this requires there are multiple answers. Okay. This is one dirty question. How many follicles? Purely if you read you will know.
C sir.
Huh? 5 or more follicle in upper dorsal conjunctiva. There is some grading of the trachomatous lesions. Filamentous fungi, how do you treat?
Natamycin. Natamycin.
Natamycin is what you need to use. Recurrent erosions are a feature of
Corneal dystrophy.
corneal dystrophy. Another very, very dirty topic where cornea guttata, Fuchs endothelial dystrophy. I never understood that. I taught it also without understanding. That's a different thing. For entrance, you have to read corneal dystrophy is one dirty topic. But at least 10 points will be there. Commonly asked in entrance. Now, doctor, anti-uveitis, what is except?
C.
So basically, anti-uveitis may you find secondary glaucoma, complicated cataract, etc., etc. It's more common with partial uveitis, that is the retinal detachment. Retina is more common to the closer to the posterior uvea. Now, what is uveal tract? Iris, ciliary body,
Choroid. Choroid.
choroid. Good, thank God. It's not. You did not start from cornea, sclera. From there you did not start. So, atropine is the drug of choice in
Iridocyclitis.
iridocyclitis to give the rest. Choroiditis,
Steroid.
you have to
Steroid.
use the steroid. Tonsillitis, what is true?
More common in children.
sir.
D.
D sir.
Huh?
D sir.
Chronic is more common in children.
More common in children. Sir.
I think this also has this also need repair with multiple options. Okay, parotid tumor which has a neural invasion leading to pain. Adenoid cystic carcinoma. Tympanic membrane, blood supply and is very important issue. Yeah, what is except?
Facial artery. C.
So you have maxillary artery, everything contributing. Depth of middle ear is least in the middle because of
C.
both the factors, convexity of promontory and concavity of tympanic membrane. Pinna basically develops from
First and second.
First and
B.
second.
first and second arch. Paranasal sinus adenocarcinoma is more common in
Ethmoid.
ethmoidal sinus. Functional aphonia is typically a
D.
Bilateral abductor.
bilateral adductor.
Adductor.
One question on vocal cord paralysis
Abductors.
is a favorite question. In case of abductor,
Abductor sir adi.
Huh?
Abductor sir adi. C option.
Adductor. Adductor. Sir. Adduction is for phonation.
it's a real fix. Yeah, I think ENT may there are ENT ophthalmic quite a few key errors are there. Just will correct that. Okay, benign paroxysmal positional nystagmus by what will be in otoscopy?
D. D. No abnormality.
Because it is due to otolith which you can't see in the membrane or anything. Supermeatus of the nose,
D.
how long it will occupy?
D.
D, sir. D.
1/3.
Posterior
Posterior
1/3.
1/3.
Then pain in maxillary sinusitis,
A.
A.
in fact it will be spread diffusely to all these locations. Okay, doctor. Shoot an answer.
Egg on side. Egg on side appearance.
Egg on side is what Nafi says. Somebody said?
Boot shape.
Boot shaped. Which boot, doctor? Nowadays is produced like this. Anything else? Let's see our online classmates. I am very happy to see about 45 plus viewers and another 100 more across the centers. So let's see, ask our classmates. Please punch your answer, doctor. Please give one big clap for the egg on side, which is fact. So where is the egg?
TGA.
This is the egg. It is like a string. Normally, doctor, what is the cause for the hilar prominence? Aorta. Why it is contributing to prominence? Because it receives the entire systemic blood from the left ventricle. In this case, where is the aorta entering into? TGMA? Right ventricle. So it is not receiving that much gorgeous blood. That's the reason it will be almost very thin like a string. So the hilar shadow becomes like almost a string, making it the typical egg-on side appearance when there is a complete transposition of the great vessels is what need to be remembered. Good, but good try with those people who said boot shaped. No problem. 4-5 boot shaped, if you see, you will know what puma will produce, etc. Now, commonest cause of pyometra. I know you will fight with me.
B. B. Endometrium.
Endometrium.
Pyometra, most common cause is carcinoma endometrium. Second most is treated to be senile endometritis. Senile endometritis. CA 125 in all except
PCOD.
Huh?
PCOD. D.
That's right. In all except PCOD. Females are receptive only once in a year in the mammalians.
Estrus.
What is that called?
Estrus cycle.
Estrus cycle. In human beings, we are 24/7, 365 days into the activity. Then, clue regarding precocious puberty.
A.
Maturity is attained early, and what is the age is important.
A.
6 weeks amenorrhea, urinary retention.
A.
A.
A. A. Retroverted.
6 weeks amenorrhea.
Yes, sir. Sir, C. Fibroid hemorrhage.
Huh? Why it is not, you want to say retroverted uterus? Retroverted uterus, if it lead to retention, it need to grow up to 14 to 15 weeks of gestation. But here only 6 weeks amenorrhea was given. 48-year-old from severe menorrhagia, but you may have a doubt why it is leading to amenorrhea. No? You didn't ask. Cervical fibroid, impacted cervical fibroid can be an impeding factor for the menstruation also. Then 48-year-old female, hormone replacement therapy.
Estrogen.
Estrogen. We want you to get 30 out of 30 in gynops. HRT except. Helpful in all except.
Coronary artery disease.
Osteoporosis, flushing, vaginal atrophy, everything. There are some controversies regarding its protective effect on coronaries. Rather, instead of helping coronaries, it may promote thrombosis and you may end up in definite heart attack. Now, CIN2,
5%. 5%.
5% chance, but don't tell that generally you are 5% only correct in your diagnosis. So 5% chance of progression to malignancies. Then colposcopy, what do you see?
Condyloma.
Condyloma.
Punctuation, white epithelium, they are all the important features which are suggestive.
0.2.
Cystic glandular hyperplasia to malignancy, what are the chances?
1%.
Huh?
Yes. 1%.
Very good. Our Karimnagar students are saying fibroid should cause menorrhagia, why it should cause amenorrhea? Impacted can cause anything, it won't let the blood come out. So it is 1%, that's good. Okay, doctor. If you answer this question, ready, we'll keep the cardiology seat spade. Huh? I heard Abdul
Globular heart.
instantly saying, what is your answer, Abdul? Epstein's anomaly you want to say. Any other answer?
Egg in cup.
Egg in cup. Where is the cup? Only egg is seen.
Sinuses.
What is the shape you are seeing? Heart. Box shaped. Where do you find that?
Epstein's.
Please give one big clap to Abdul. Abdul, don't forget to take radiology. You are naturally good at it. Maybe you answered based on intermittent sinuses. Look. Oh, beautiful. Then Deccan Medical College will be proud to find a upcoming prodigy in the Twin Cities. All Charminar patients will be queuing. Now, features of dysgerminoma. And you can appoint me as a brand development manager. I will also get the students, patients from Vizag also. Now, features of dysgerminoma. Give me an answer, doctor. Basically, unilateral. Dysgerminoma is not a virilizing tumor, young females, unilateral, etc. 13-year-old girl.
Sir, dysgerminoma is like seminoma, which is like fibrous, more fibrous, so gritty will also be.
Which is?
So D.
Cut section gritty you thought,
Okay.
Gritty is more Brenner. Brenner is more gritty. Gritty means that characterizes Brenner. Yeah. 13-year-old girl. Casualty. Tense bulge in the region
C.
of hymen.
C.
Imperforate hymen. That's good. Once more, imperforate hymen, congenital hyperplasia, testicular feminization syndrome. You need to review. Now, visual loss, breast engorgement means prolactin. Most common cause?
PCOD.
PCOD. Pain in endometriosis? Depth. Then 30-year multipara? What do you want to do?
D.
B with tubal ligation.
Has uterine prolapse? What is the management of only Fothergill or Fothergill with ligation?
With ligation.
D.
Vaginal hysterectomy in a 30-year-old.
Multipara.
So? No.
With ligation.
No need no sir if multipara.
That's right, but Fothergill is done in women below 40 who want to retain their menstruation and childbearing function. Right?
Correct.
Since she is multipara, you want to say that she need not require children. Hence you are doing tubal ligation.
Why should you preserve menstruation?
Oh, you have a point to say, but vaginal hysterectomy may be much more
Age, sir. More age.
probably there is also a school of thought coming from Shilpa saying that hysterectomy predisposed to ovarian dysfunction. So my lord, no induction of a premature menopause in a otherwise jubilant young woman.
Premature menopause will be there if ovaries are removed. No sir, here we don't remove the ovaries.
But hysterectomy is known to predispose to ovarian I don't know, but that's what we'll anyway take a call on option B, why it has become correct from a obstetrics, proper obstetrician. Yeah. Now doctor, pregnant women with fibroid uterus develops acute pain.
C.
Easy question. Red degeneration. Asymptomatic carriage in female commonly.
Endocervix. A.
Endocervix.
It is in the endocervix for the gonococcal carrier state. Most important indication for surgical repair if there is a bicornate uterus.
Habitual abortion.
habitual abortion. Colposcopy, why do you do, doc?
Abnormal pap smear. Sir, A, sir.
Scopy.
A also, sir.
A and C, sir.
I think multiple answers are right because it's not abnormal pap smear also is an indication for colposcopy, also to delineate the biopsy site.
So,
Sorry for that
yeah,
question. More than one answer being right. Okay. 27-year-old serum ammonia is elevated with PT hepatitis prolongation. What do you want to do?
A.
A, sir.
A.
Huh?
A. Immediate delivery.
PIH. HELP syndrome.
Basically, what is your diagnosis in this given case?
HELP syndrome.
Acute fatty liver.
Help.
If you do spontaneous delivery immediately, it will resolve. But if you procrastinate, that can lead to renal failure and hemorrhage. So immediate delivery. You have just to deliver an infant weighing 2.5 kgs. Still the membranes are bulging through a dilated surface and you found a small part.
D.
It is not the delivered baby's part.
D, sir.
It is undelivered twin.
D, sir. D.
C.
D.
C.
D you want to see LSCS.
C. C. Because fetal heart rate is 60, so the baby is in distress.
What do you want to know? 60 per minute is not sufficient distress. It is in distress.
So why wasting time for LS? Go for mid forceps.
Internal version.
Internal version is the only indication for second delivery in obstetrics.
Correct.
And mid-forceps is not used these days, it is contraindicated.
Mid forceps is not used. That is agreeable. I think. Now the question is between cesarean and internal version.
To arrange the patient for cesarean section, you will not be investing a lot of time. That 60 for heartbeat will not wait for you to go for a section.
So turn the baby and push him out.
So that is the only indication in the cesarean is internal version.
Due to the emergency of time, non-availability of anesthetists, and the obstetrician senior having a vacation, internal version is the one which is preferable because you need to do emergently. You don't have time to do anything else. So that is the point. But why internal podalic version is very uncommonly done? Because nowadays twin deliveries means we are diagnosing it much earlier. At the level of conception only we are discovering nowadays.
B anada.
I still remember my younger brother and sister who are 12 years younger to me. They were born in Karimnagar. So until the delivery obstetrician don't know. There are two babies bolke. One baby is over. They are the fifth children in the family. The two. So everything is packed. Show is over. Let us go home. Because all kids are born by normal delivery. Then once more pains continued and she came running and I think there is one more baby inside and then pulled out. That was in 1982. So every time twins and podalic version means I remember my younger kids. So 35-year-old, triangular area of erythema in the left upper outer quadrant of the left breast. What is your answer?
C.
Basically, it's a case of puerperal mastitis. So dicloxacillin is the one which is the initial treatment of choice. 17-year-old with chromosome mosaicism, primary amenorrhea.
Sertoli lady.
B. Virilization.
B.
That makes it certainly which lead to development of virilization. Doxorubicin lead to, one more repeat, cardiac toxicity. Pap smear shows high grade squamous intraepithelial lesion.
Diagnostic conization. C.
What do you want to do?
Diagnostic conization. C.
So therapeutic diagnostic conization, you must know the indications.
197.
Amenorrheic patient has pituitary ablation. What is the regime?
D.
Raju, give a call.
B, sir.
Give a call to the cab too. Yeah, what is the answer?
D.
That's right. So she lost the ability to produce the endogenous gonadotropins because the pituitary got ablated. That's the reason we need to give the exogenously. That's the idea. 18-year-old bimanual examination shows supratendic pubic tenderness. So what do you like to consider?
Cystitis.
Cystitis is different from urethritis, is different from vaginitis. So cystitis may pain, severe abdominal pain, diffuse tenderness. So now we have got very good antispasmodic drugs to relieve. We give pyridium, we give antibiotic, and that brings a dramatic relief. Now doctor, a patient with 2 living issues
Hysterectomy.
placenta accreta,
Hysterectomy.
right? That's right. Then fetoplacental function. What are the tests that are being done to know the well-being of the baby? Yeah.
B.
Rest in left lateral position, so increases the blood flow. High protein diet and oxygen inhalation, all of them are basically used. So thanks for the patient attending, doctor. Maybe 7 to 8 questions, 8 to 9 questions require repair,
Answers.
definitely. From next week we will try to give the errata of the questions that went wrong. And we wish a happy Pongal Sankranti to all of you, and this summer you are going to do post graduation. That is the only slogan that should be there in your mind. Maybe this Wednesday we will have a test, but we may be missing the discussion, but on next Sunday we will have test and also discussion. Thank you, doctor.